Hey, my name is Erica. Welcome back to my channel. Today I'm taking you throughout my day on a call shift. I am on GYN or gynecology call and I'm on a 24-hour shift. So come along with me for our 24-hour journey. First things first, it's time to round on a GYN patient that's currently over on labor and delivery. This isn't typically something that I'm responsible for as the GYN floor call person, also called the mouse. However, I know this patient really well, so I just wanted to help out my labor counterparts. Next are gyn-onc rounds. How we do rounds really depends on the attending's preference. Most days we actually sit around a large table and just talk about our patients and their plans, and then we go see them separately afterwards. But today we're doing something called walk rounds, which is essentially where we use these WOWs, which stands for workspace on wheels, and we move from patient room to patient room. The resident or medical student that rounded on a specific patient will tell the team about the patient in a SOAP format. SOAP stands for Subjective, Objective, Assessment, and Plan, where subjective includes what the patient reports. Objective is reporting the patient's vitals, ins and outs, and their physical exam. And the assessment is a one-liner summary of the patient, and the plan is the particular plan for the patient's problems. Time for a quick snack before I get to work on some of today's tasks. Whenever possible, I try to make call-in consults the first thing on my list. This gives the consulting services more daytime to review the patient's case and to evaluate the patient. This also gives us time to make any changes that they recommend and to observe the effect of these changes throughout the day. Since we're lucky enough to have gyn-onc fellows at my residency program, there's always an on-call fellow. They're not really in-house or physically in the hospital, but they are easily accessible for the full shift. So if there's a non-urgent update I want to relay to them, I usually text them throughout the day, but I'll call if something's more urgent. Right now, I'm in kind of the headquarters of this 24-hour shift. It's a big workroom. We have a bunch of computers and space because this is also the headquarters for the oncology department during the week. Whenever we're on mouse call, which is when we're taking care of these gynecology patients, our main roles are to follow up on different labs, imaging tests, and then also to make sure that the patients are safe throughout the day. For now, as you probably already saw, I was able to do some snacking. I had a banana like pretty shortly after I got here. I had a little thing of pineapple chunks, which was amazing. And then I also had a little packet of goldfish. We just have some random snacks on our onc floor that the team during the week brings. But since it's 3 o'clock, I'm kind of hungry for a real meal, so I'm gonna head down to the cafeteria now. But first, I'm gonna head over to the nurses station, make sure they know that I'm gonna be off the floor for a few minutes, and also just ask them if they want me to bring up anything from the cafeteria, because I know that they're also working hard here on the GYN floor. We do get these $5 blue tickets each shift that we work for more than 12 hours, which is pretty common in OBGYN. But the silver lining of working that much is that I don't have to pay for my food. Here I am picking up the most important meal of the day. I like to do a little mix between a plain drip coffee with this insanely sugary sweet latte machine. One of the most common reasons that we admit people to our gynecology oncology service is for routine post-op management after a big surgery. Some of the major milestones that we ensure our patients can meet prior to being discharged are things like 1, their pain is well controlled with oral pain medications that they can go home on. 2, that they're able to tolerate a normal diet without significant nausea and vomiting so that they can sustain themselves at home. 3, that they're able to ambulate on their own, and our PT does an incredible job of being able to evaluate our patients to see if they need extra assistance. We need to make sure that they are able to empty their bladders on their own. 5, depending on the kind of surgery they have, we want to make sure that they can pass gas before they go home. So one of our patients on the floor is a post-op patient who is planned to go home today because she was meeting most of her milestones this morning. I'm just doing an afternoon pain check because she was pretty tender this morning to make sure that her pain is still well controlled even after getting up and around her room and walking around a little bit. So I'm gonna go head over to her room and evaluate her now. So I just got a call from the radiology department for one of our patients who was getting imaging, and they were concerned about something that they saw. So this patient could potentially need to go to the operating room. Whenever it's the weekend or overnight call, it's usually the third year who's on consults. That's the one that ends up going to the operating room. So right now for this patient, I'm going to make her NPO. I'm gonna hold her prophylactic Lovenox. I'm gonna get some stat labs to make sure that we have active coags and a type-in screen, so in case she needed blood for this procedure, we would have it on hand. And then I'm also gonna alert the third year about what's going on, so she's aware that there's a potential that she'll need to go to the operating room today. I already talked to the patient and assessed her, got some vitals on her. She looks totally stable, so that's really reassuring. But a lot of the times for our sick people on the gynecology floor, there is potential for people to get really sick really quickly, so we need to make sure to monitor them very closely. Right now, I am writing a note about out what happened, and I'm waiting for a call back from the attending doctor who's on, who will ultimately make the decision on if this patient needs to go to the OR. So the good news is that patient I mentioned earlier who we were thinking might need to go to the OR had stable labs. So we're hoping that we can avoid another surgery for her, and we'll just watch her really closely with serial labs and physical exams and vitals over the night. But I just got a call from the gynec fellow about a patient who's down in our clinic who is having some pain. So I'm gonna go run down there and assess her to see if she needs to be admitted or if this is something that we can manage outpatient with oral medications. So I just told that patient that her labs were totally stable and reassured her, but told her what symptoms to tell us about if they come about, and now I'm headed to the clinic. So I just talked to the gynec fellow about the patient I evaluated downstairs, and she does have some lab findings that are a little bit concerning for us. So I'm gonna go run down there and get her admitted to our floor. So I just got a call from the lab with a critical result. So oftentimes if there ever is a lab result that needs to be followed on like pretty urgently or quickly, the lab will actually call the provider and or the nurses to let them know about that result. So I just got a call from the lab. They said that one of my patients has a low hemoglobin. So I went to go evaluate her, and she overall looks very stable, which is great and doesn't have any signs of bleeding. And so for right now, since she is feeling a little bit symptomatic from that with some dizziness, I will transfuse her with some blood. Now I'm working on admitting a patient who presented as a direct admission. So I do need to do a pelvic exam for her. So you just saw me grab a sterile speculum, gel, sterile gloves, a pelvic wedge, and some procto swabs. So typically there are two people who are covering the GYN service. There is a third year overnight and on the weekends who is responsible for answering patients from the ED and from the floor. And then there is the mouse, which is what I'm doing today. And we take care of patients who are already on the floor or come in from a direct admission or transfer to our floor. So the third year who is on pager just calls reports about a patient who is coming up from the ED not too long ago. And she actually just got to the floor. So one of my roles is to assess patients basically when they get to the floor to make sure they are still stable. So I am gonna run to her room right now and just do a quick evaluation, make sure she's okay, look through her orders in the computer to make sure that all of her orders reflect the things that we are doing for her. The other super important part about 24 is ordering dinner. So I ordered dinner with the night's team, and these are our orders. So I just finished having our team dinner with the labor nights team and the consult friend. And now I'm headed back down to the gyn floor because someone just spiked a fever and I need to evaluate them. All right, so I am back now from assessing that patient that had the fever. The first thing that I always do is to check in on their vitals to make sure that they are hemodynamically stable. People who have fevers, depending on what their risk factors are and what they're admitted for, etc., have a risk of becoming really sick really quickly, especially if they become septic. This patient luckily was really stable. So the next thing I did was a physical exam to look for any specific signs of infection. Things that I think about when I hear that someone has a fever, things like cough and shortness of breath, new abdominal pain, diarrhea, dysuria or pain with peeing. I also think of clots because clots can cause fevers. So I just did that kind of evaluation for this patient and also got some labs and some imaging. So I'll need to follow up on those. And in the meantime, have some antibiotics going. This part of the night, I eat a bunch of snacks and then feel really, really sick. So I just got back into the room. I got called to the bedside for a patient who had a really tough Foley placement, and now back to my workroom to just review through everyone's labs. Everyone on our service gets, not everyone, okay, most people on our service get labs routinely to monitor things like their blood counts, their electrolytes, their kidney function. So I look through all their labs around right now. It's a little bit past midnight. All right, y'all, it's currently 3 in the morning. I just finished reviewing everyone's vitals, labs, and urine output, making sure they all looked adequate and normal. And if they weren't, making sure I followed up on those things. Now, since it's 3 o'clock and I've done all those things, I am considering taking a little bit of a nap. I also like to make a little summary email about all of the things that happened during my shift for the morning team to make their jobs easier when they round. We also have handoffs that we update, but I feel like this document is sometimes helpful because it's a concise kind of summary of everything that I did and things that changed since they last saw them yesterday. We have secure email, so it makes it easy to talk about patients in a safe and encrypted manner. So I just drafted that email, and I know I still have about 4.5 hours left of my shift. So if there's anything else that happens, I'll make sure to add it. Usually I'll send it around like 4:30, 5 o'clock because they typically get here pretty early to round. Usually they'll get in around like 5 or sometimes even earlier than that, depending on how many patients there are to round on. But for now, since I am up to date on all of that stuff, I think I might actually try to take a nap. I might just try to watch like TV until I can get sleepy enough to fall asleep. So right now I'm gonna do a round at the nurse's station, see if they need anything for their patients right now. I have my phone on me at all times, so they are always able to access me or just come back into the workroom to let me know something that's going on. But it's kind of nice to check in with them before I go to bed, so it gives me a better chance of not being woken up. So hopefully I'll do my rounds with the nurses, make sure that they get everything that they need for their patients, grab a warm blanket, and then try to doze a little bit here. Okay, so update number 1 is that I got a warm blanket and I'm feeling really happy about it. It's so snuggly and I'm so ready to be bundled up on the couch for a second here on my 24. But the second update is unfortunately that there is another admission coming up from the ED. Luckily, it is a person who came through the ED. So as I mentioned before, the third year is the person who admits them and puts in all their orders and writes a note. So that means it's a lot less work for me compared to someone who comes directly to the floor or as a transfer from another hospital. The nurse said that she just got report about this patient, which means that the patient will be coming up to the floor probably sometime soon. It's hard to get an exact ETA because it depends on transport and all these things. So I was gonna snooze for an hour, but since she's gonna get here pretty quickly, sometimes it just makes me even more drowsy if I'm only asleep for like 30 minutes. So I'm just gonna watch some TV and wait till she gets here so I can see her. And then if I have time between when she gets here and when I need to get ready for the day, I will take a little snooze. All right, update for you. I was able to sleep for about an hour. So it's around 4 o'clock right now, and I'm gonna get ready to see the day team. Like I said, they come in pretty early, usually around 5, sometimes earlier or later, depending on the patient census. But things that I do to get ready for the day are 1, go through everyone's handoffs again and make sure that they're up to date with all the most recent events. 2, send that email that I mentioned earlier that gives all of the patient information of events over the past 24 hours. 3, print out the list with the updated handoffs on them so that way everyone has a list to round with. And 4, part of my job is also to round on certain patients. So while the days team rounds on all the oncology patients that have been admitted since yesterday and that they know of and have seen before, I'm responsible for rounding on any patients that I admitted overnight. So I had 2 admissions overnight, so I'll round on them. And then I also round on the benign patients for the green team, which is our benign gynecology team. And we currently have 3 patients admitted to the benign gynecology team. It's 4 o'clock now. I don't want to wake them up too early, but I'm going to go through their charts, prep their notes, and then probably start waking them up to round on them and finish writing those notes. The best part of the day is watching the sunrise, waiting for the day team to show up. All right, y'all, so I just presented the few people I admitted overnight, and it's time to go home. I'm on my way to the parking garage right now. Woohoo! We survived another 24-hour shift, and we are intact and getting into the car. There is truly no better feeling than being greeted after a 24 shift by Bama. I just got home from my 24-hour shift, and I'm gonna play with the dog in the yard a little bit first and then hop in the shower and probably pass out. Sometimes after a mouse shift, I actually feel okay and can enjoy my day a little bit before going to sleep, which is super unlike a labor shift where I pass out immediately. But for now, I'm gonna end this video. Thank you so much for watching. I hope you enjoyed a day in the life of a resident on a 24-hour shift. If you like this video, give it a thumbs up, and I'll see you in my next video.